How do you study it?
When you're studying, you're
Yeah.
doing labs. So you're doing labs, you're dealing with cadavers, you're doing
Cadavers, okay, the dead bodies,
yeah.
but Asian
So,
dead bodies.
yeah. So that's fine because they're dead. There's no
Okay,
lawsuit
yeah.
on you if anything goes
Oh,
wrong. Do you
okay,
get it?
mhm.
So in China, actually, I have friends who've done their internship there. And the thing is, you're not allowed to touch a patient. Like in Kenya, like you could fix IVs, you could draw blood, and you can actually be hands-on with a patient.
You're not allowed.
You're not allowed
If
to
you're
be
not,
hands-on if you're not Chinese.
Oh.
Yeah. So if you're not there, because
Why
the
is
thing is like
that?
the hospital doesn't want to face a lawsuit. Sorry. So that's why they kind
I mean,
of don't allow.
You're practically like any other student. So if it's an Asian
If okay, the thing is,
intern,
like,
they can do that.
the thing is like I was studying with foreigners, so I wouldn't know. But Asians obviously because they have to learn and that's their country they're going to work at. So the thing is also you have to know Chinese. Like your Chinese has to be like A1. You literally need to know anatomy in Chinese as well. So obviously you like I learned it for the first 3 years, and the thing's like it's not going to be
Yeah,
as
speak
perfect.
Chinese?
Yeah.
You can.
Yeah.
Really?
Not fluent, but I can to
Oh,
get
wow.
around. Yeah.
Okay.
So, because of that reason, like the doctor will literally just tell you the patient's, what's the problem and like what kind of management they're gonna do for them, treatment wise. So yeah, you're not going to be hands on. That's precisely why I took mine here.
Okay. So now, why the interest in gyno, and not maybe like what's the name? I was told this name. Helping mothers give birth. What's that name? It's some crazy.
Obstetrics?
It's obstetrics.
No, obstetrics and gyne is just one field.
It is.
No, midwives. It's helping
Yeah.
mothers give birth.
Isn't
That's
it
midwife.
It's
It's the same thing.
Come on,
okay.
is
It's
it?
completely different because
Yeah.
this you don't need to do a whole 6-year course.
6 years,
Yeah. Medicine is
study?
6 years.
and then internship, and the other thing it's called
Okay, so
posting or whatever.
Yeah, posting. You have to do another year of studying for your board exams.
That's like how, in total, that's like
Yeah,
8.
like you have to like really be
How
really
long
wanting
before you
to
start to enjoy your money?
Me right now, like I have to wait for 1 more year. So, so the thing is, you have to go through the ringer. But I feel like this
Yeah.
is better than most countries.
Really?
I feel like because the thing is like they have 6 years of study, 4 years of college, I think. Then I don't know, 4 years or 6 years of medical school, and then they have interning 2-3 years. I don't know, like I'm not sure exactly the time period. And then they have posting so that they can do residency, and then after you can become like a
Now you can become.
doctor. Yeah.
It's a whole ass process.
Yeah.
So but why the interest in that? Why not something else completely?
Okay. The thing is, personally, it's a field like I just like, and I feel like I can relate to so much, and I feel like I can do a good job in that field, and I can bring more women. Like I'm Muslim. My culture and my religion kind of needs more women in that field. So I feel like
How
I'm
so?
a woman. Because the thing is like they're uncomfortable to like have all women at the end of the day, like they would choose a woman because of cultural and religious reasons.
Yeah.
So they would want a woman to tend them then.
Is there a
rather than
scarcity in like female? Oh yeah,
Yeah, there
and
is,
I've had actually like these
yeah.
very few female gynos
Yeah.
in Nairobi as well. I think
So that's like majority of the reason why I also like
would
love
want
the
to
field.
get into it.
Yeah.
Yeah, and then now we were just making this. Yeah, we were talking. Yeah, before we made that bet,
Yeah.
IJ was like, first of all, I go for this gyno checkup. And then I get there, it's a man. She was like, hell no, I'm not doing I'm not doing it.
You see, like no
And I
girl is
understood.
comfortable to
Yeah.
kind of like
Yeah.
do like have a man as her physician
Yeah.
when it comes to like
And it's kind of like something that's just necessary, like getting just
It's
checked.
just okay. Even
It's
even ethically speaking,
Yeah.
you know, there's if there is a woman and the patient prefers a woman to examine her, she can choose what like doctor she would want.
And
to.
I have some
But
friends
if
who
she
actually
doesn't have, then
prefer
they don't
male.
have.
They say like the male are more patient when
Well, it
doing
depends
this.
person to person. At the
Yeah,
end of the day,
yeah,
I
I
feel
guess
like
so, right?
Yeah, whatever.
And just because that's your field, is there, because maybe for people who are listening, because of course definitely like young girls, people who've never like even maybe gone for checkup, is it necessary to go for checkups, and how soon are you supposed to start going for such checkups, like from teenagehood,
I
from a certain, I mean, I don't know.
Definitely, like I feel like from teenage, because obviously I feel like there's so many things you don't know about yourself. Like you can find yourself, like I'm not going to be like going into the gory details,
Yeah.
but you need like, I feel like we do need to like get examined and just know that, you know, your pH level in some areas is like right, and you know
What's
your-
that? I swear, listen, I'm just trying to educate
okay,
people,
like it's
because
easy
like
for women to like get like infections, right?
yeah,
So
or like
if you don't know,
I've had of
Yeah.
yeast infection.
Yeah.
Is that what we're talking about?
yeah. So there's different
And at
types,
times it's
but
just because of
it's legit. It's just, you know, you won't know what to do unless like you have like you go to the gynecology and like get the doctor's opinion on like, you know, what's going on down there and how to like do like what to do basically.
have you ever gone for one?
Checkup, yeah.
You do?
Yeah. Like
Well, now
you do go
you
and
need to
get
take-
checkups, because the thing is like if you feel, because
Yeah.
at the end of the day it's
No, a gyno checkup. That's what I'm talking
yeah,
about.
like you go
Well,
to a gyno
take.
checkup, like if you
She said. IJ said if I get somebody who can hold her hand and take her through it, she's gonna do it.
yeah.
So if she hasn't done it, I think you're gonna.
I've done it like a long time ago. I think 2-3 years ago. I don't know, but not
But
like
how often should you go? For anyone who's listening, like just for, because you know,
okay.
like with this millennial era, so many people take so many things for granted.
Yeah.
Like even for me, like my situation was like really bad, and if it wasn't for IJ, I wasn't gonna go
But that's the
to
thing.
hospital.
You need to have a reason why you're going there. Like not.
Or you just can't go for a
Yeah,
check.
you can just go for a checkup if you wish to, and it's good to do it like once a year or something like that, right?
Yeah.
So, but if you feel like something is not right, that's like a given. You need to go.
Okay.
You get it?
Okay, what are some of the things that can be caused as a result of not going for that
No,
checkup?
first of all, like, okay, the thing
What-
is, like,
what can
now,
be-
now, like, breast cancer is really, like, you know,
Yeah.
one thing that's really affecting us.
Yeah.
So I feel like that is, like, every woman has to get checked up. Like, she needs to, like, go and see, you know, if she's good or not. So I feel like definitely you have to, like, do it once in your life. You have to have done it just to be safe.
Just go get your checkup done.
To get your checkup done so that you can be, yeah.
Interesting. You have a very nice way of summarizing everything, like shoop.